It's happening. Adults across the country can buy cannabis. People have a lot of questions, so I invited some friends over to talk about it. Joining me today is Alexandra Perry from Addiction Rehab.
I'm like a counselor here. Thanks for sharing.
Lachlan Cheng, a cultivation consultant.
I mean, I'm not paranoid. I'm not paranoid about it. What are you talking about? It's fine.
And Tyler James from Eden Medicinal Society.
A lot of people are, very gung-ho on saying, cannabis is this miracle drug.
I'm Chuck Rifici, and we're talking the biz. Some say cannabis causes psychosis. Others say it's good for treating PTSD. Is cannabis good or bad for mental health?
I think it has to be both. I don't think you can attribute a single property to it. I think if you want to discuss its use therapeutically or particular compounds from it therapeutically in something like PTSD, then obviously as a tool it can have good and bad outcomes, just like, as we're obviously drawn to naturally, the comparison with opiates. Opiates can provide, wonderful relief and palliative care. They can, they're essential medication in many procedures that we do, but they obviously have a massive downside.
Mm-hmm. I think it's really important to keep in mind the intention of the use. So, if we're doing a good job in the health field at looking at people on a client-centered basis and individualized planning, getting someone to move from Percocets or Oxycontin for pain management is going to be a really holistic approach for that individual. Same thing with PTSD. If the person is currently, managing symptoms of PTSD with alcohol or, a more severe drug, allowing them to have cannabis as an option, I think could be something that's really positive, but it really depends on the intention of the use.
Yeah, I know especially a lot of individuals that we would encounter, even through our storefronts, whenever they had anxiety and they were to take, high THC, even like sativas or, strains like that, it would trigger that even more so. And it was something that was a really uncomfortable experience about, which they would, depict to us, upon their next visit. So it's one thing that, individuals, again, what we'd always tell them is when self-medicating, always, remember that, the evidence that you're trying to offer to individuals is very much anecdotal, because everybody's different, but it really is on the person to really, educate themselves to see with the condition that they have what might be the best form of cannabis for them to consume, whether it be THC, CBD, and then in what derivative, whether it be through topical, cream, tincture, or smokables.
Is the method of use actually has a major difference in the effects, right?
Precisely. So what we've at least found through the clients and patients that would come down to our storefront is that individuals who had issues and were trying to combat things like anxiety, they would more so gravitate towards not necessarily the flower, but the CBD tinctures in capsules that would be offered to us.
What is a tincture?
Tincture is where you have the CBD oil in a transfer liquid, preferably coconut oil, because it allows for the fatty acids to break it down. And it's just taken sublingually under the tongue. Just 3 droplets, try to hold it there for a few minutes so it can get released to the bloodstream faster.
The thing is it's actually more of an edible oil rather than a tincture because of the concentration requirements. So tinctures are a different definition, but again, the sort of sublingual dosing that it requires actually requires a high enough concentration that you can leave a low volume of oil under the tongue, and then that actually bypasses the liver, as opposed to when you swallow it, goes through your stomach, and then you get the Delta 11 THC, which obviously has a completely different set of characteristics and leads to the general sort of start low, go slow sort of protocols, because edibles have a very hard dosing regime because of the Delta 11 and first pass effect.
But going back to, kind of the harm, so there's obviously benefits and negative factors with some use of cannabis. We hear a lot about psychosis. People think it, sometimes thinks it causes schizophrenia. The literature I've seen seems to indicate that there's perhaps an early onset of psychosis. Is that true? Do you agree? And is that the only real risk? Are there other issues that whether it's anxiety or other symptoms that'll get worse with cannabis?
I think long term, unfortunately, it's unknown.
I don't know if this is outside of the discussion, but I've experienced a lot of individuals who've come through my facility as a mandated client, and a lot of times through a psychosis, there's been criminal activity, which I think is, a concern, obviously, and something that, I would like to have people look at a little bit more closely, because, you know, it can be a psychosis that lasts 24 hours to 48 hours and completely change someone's life. Even though they're just thinking they're smoking a little bit of weed, they've gone and become physically abusive to a police officer or their family, or been formed at a hospital, and these things don't leave a person. It's part of their history now, and they have a label or an identity or something that's really negative, right? So I'm not saying that there's a correlation necessarily. I'm just, you know, sharing the observations that I've experienced.
I guess, you know, going to pain, I hear from pain physicians were certainly the earlier adopters in I think prescribing cannabis in Canada in a time when the medical community was not a huge fan, you know, 5 or 6 years ago and more. So we know a lot of benefits for cannabis and pain. Are there any concerns?
Not for me so much. I actually think that on the pain management level, it's a really good option for people.
I mean, I think I can speak to this from personal experience. You know, both as a chronic pain patient, have gone from 150 milligrams daily of oxy post-surgery to, you know, intermittent use now as part of polypharmacy. I think the issue to address here is that one, our just general treatment and use of chronic pain is not good as a general rule. I think first of all, we can't discuss pharmacology without discussing all of the ancillary effects that need to be in place, whether it's cognitive behavioral therapy, psychological support, you know, lifestyle maintenance. There are so many factors. The fact that exercise, you know,
You can't just prescribe the drug and walk away.
it doesn't work
Which is
like
what
that.
happens.
Yes. Just like with everything, you know, there is a balance that you're trying to meet, whether it's with OxyContin or with cannabis. You're essentially trying to improve quality of life. And if you don't have sort of a firm metric or an ongoing relationship with your medical professional to allow you to sort of have a reasonable touch base, especially outside of yourself, because as a patient, I mean, I think generally as individuals, all human beings are pretty bad about making judgments about themselves. We all think we're smarter, faster, and prettier than we are. But once you accept that and and if you're lucky enough to be able to put yourself in a supportive care situation where you can sort of follow best practices and work around it, you can definitely have a lot of benefits from it. But there are, just like with everything else, there are downsides to being used. I do think that they're significantly lower. I think the therapeutic index, so the safety ratio of the drug is a lot better than opiates. Although on note, actually for most, depending on the source of pain, unless it's an inflammatory response, you'll actually probably normally have to have a THC combination with it. CBD is really more for inflammatory or sort of sub-responses, or obviously anti-epileptic and things like that. But for chronic pain patients, almost all of them require some ratio, typically starting at 1:1 and personal preference all the way up to 4:1.
So four times the THC
Yes.
to the cannabidiol. Yeah. Great.
Yeah, I think that was really well said, and I agree with that standpoint and position. And I think just to add onto that, if CBD or with a dose of THC is sort of a treatment plan for a patient, I think again, just emphasizing the importance of encouraging the individual to utilize other coping strategies and making sure that their expectations are realistic. I think it's important to ask the individual what they are okay with managing or what they're able to manage, and then go from there. So give them that prescription or the THC and the dose or the CBD, but then how are we going to use exercise or yoga or meditation or, you know, any other variation in combination too. Like, I think it's important to have both sides happening.
Yeah, definitely. Because I think, you know, even when I gave some topical cream to my grandmother for her arthritis, I had the THC, and I'm like, listen, grandmother, this isn't going to allow you to do backflips, but it'll allow you to cook, it'll allow you to, like, you know, knit again, you'll have more range of motion, still feel some uncomfortability, but it was, again, like you're saying, showing her that this will help to, one, like alleviate pain, but then managing her expectations of what the inevitable outcome would be. You know, really allowed her to look at utilizing cannabis and this topical with other things in her regimen so that she can have, you know, more comfortable living standards, you know, care, all that stuff.
It's kind of a reflection of our society in many ways, though. We've become more comfortable with the idea that a pill can fix stuff. And I think that, I mean, it is an example by the fact that the placebo effect is statistically stronger today than it was when we started measuring it. It just shows that, you know, as a society in Western culture, we've been raised, there is a pill to fix it. And unfortunately, I think we're coming to realize that as clever as we may seem, we're not clever enough to come up with those pills yet. So
We still have more to do to clear the smoke on this issue, but thank you for joining me today.
Cheers.
thank you, Chuck.
Pleasure being here.